As a plastic surgeon, my success rate is high for closing wounds. Early in my practice, I reviewed my success in wound care and found out that nearly 70% of the wounds referred to me as non-healing were closed without the need of major surgical procedures. If I performed a surgical procedure, it was often simple debridement or surgical cleansing of the wound. Most of the time, however, all I did to close the wound was to improve the way the wounds were cleansed and dressings were applied to the wound. To understand what is happening in wounds, you must understand the following facts. Infections are the major reason why wounds do not close or close slowly. Factors like nutrition, diabetes, and many other conditions contribute to non-healing wounds. Germs that can infect a wound are everywhere: the air, clothing, bed sheets, the skin of the patient. Germs can be killed with antibacterial soaps. Dressings are used as a barrier to prevent contaminating a wound with germs and dirt from the environment and to provide comfort. The skin is covered with germs that we need to prevent from getting into the wound. This includes not only the skin around the patient's wound, but also the skin of the caregiver and the doctor as well. Like a doctor preparing for surgery, using an antibacterial soap kills the germs on the skin and prevents the germs adjacent to the wound from getting inside the wound. Gentle cleansing with a wound cleansing agent disrupts the contact between the wound surface and the germs on the open wound. The steps of basic wound care are: 1. A 10-minute antibacterial lather and wash. 2. Rinse and remove the antibacterial lather. 3. Dry the wound. 4. Apply prescribed medicines. And 5. Apply a professional-looking dressing. During a 10-minute antibacterial wash, the soap emulsifies the bacterial film on the skin and wound while the antibacterial agent kills the bacteria. The 10-minute period is important for the process to be successful. It is important to build up a lather as well, as it has the antibacterial action needed to kill the bacteria. The rinse removes the soap lather that contains the dead bacteria and skin cells. Do not leave the lather to dry on the skin. Drying is a preparation step before dressing a wound. Medicinal applications are typically applied to fight infection or accelerate the wound healing process. Dressing the wounds protects it from the environment and secondary infections from the outside the wound. It also absorbs any drainage from the wound and provides comfort for the patient. It is important to dress the wound properly so that the dressing can provide the necessary protection to keep the contamination away from the wound and provide comfort. If the doctor has provided additional instructions to fight infections and/or improve the condition of the patient, they are followed at this time. In Wound Care 1 training, these steps are the absolute core of what is done for every wound every day.